104.8, it is Channel 4, is Sean here hanging out, and we're going to talk about right now headaches and upper body aches and the unknown aspects of dentistry. And we've got a dental prosthetist on the phone joining me this afternoon, Dr. Brigitte Kunjumon. Doctor, thanks for joining me.
Thank you so much, Sean.
Doctor, let's get straight into it. So tell me a little bit about temporomandibular joint disorders. Now, firstly, how was my pronunciation? And secondly, can you explain it to me in layman's terms?
Temporomandibular joint disorders. So, first of all, we need to know what is the temporomandibular joint. So, the temporomandibular joint is the joint that connects the lower jaw to your upper jaw, or basically the skull. So this joint complex being supported by the ligaments and the muscles on either side of the face. Now, if you see within the upper and the lower jaw, in the bony structure, we have the teeth that snugly fit into each other when chewing. So basically, a temporomandibular joint disorder happens when any changes in the snuggle fit or in this articulation between the upper and the lower teeth, that will cause a strain and imbalance on the support system of the joint, and thereby it alters the harmonious functioning of the temporomandibular joint.
It's the whole time you were talking, I was just moving my jaw and feeling all of these things and how the teeth fit all snugly in there. It's very interesting stuff. Can you talk to me about some of the symptoms?
Yes. Usually the patients with temporomandibular joint disorder, they're not aware that the symptoms are with the joint. Most of them will complain with stiffness in the mouth while opening, pain in the neck muscles, facial muscles, either when opening, closing, chewing. If it's a chronic condition, it can even go into a ringing sensation in the ears, chronic neck pains, which radiates to the shoulders, and in some cases, even it radiates into the hands and the lower back pains.
Okay, Dr. Brigitte Kunjumon, this is all very interesting stuff. I'm going to go to a song right now. Have you got another 5 minutes to stick around? I've got some more questions to ask you.
Sure.
Okay, you're going to stick around. We're going to do it right after this at 104.8 Channel 4. It's 104.8 Channel 4, and we are talking about a super interesting topic right now, temporomandibular joint disorders. And here to tell us all about it is Dr. Brigitte Kunjumon. Now, we heard about these joint disorders in layman terms. Now, I want you to just explain to me, Doctor, some of the causes.
The usual causes, which, is what happens is premature extraction of teeth. That means early extraction of teeth. Probably the child, when they were an adolescent or a teen, they would have removed some behind the posterior permanent teeth and they have not got replacements for it. Progressing into the middle age also, whichever teeth are decayed, they get it removed. And the basic concept that you have 32 teeth, so if one goes, it's okay. What happens is this alters the harmonious relation between the upper and the lower teeth when one tooth is lost. As I mentioned in my first point, that there is a snuggle fit. So when this is lost, the complete balance between the teeth also gets lost. So if a tooth is not replaced, what happens is the teeth start drifting into the space that is created by the missing teeth. So that also causes a misalignment or a malalignment of the teeth. Thereby, the bite also gets altered between the upper and the lower teeth. Another cause is sometimes trauma, maybe through an accident. Third cause is malaligned teeth. We see that the teeth are proclined or the teeth are not in a proper array or a proper alignment, or improper articulation between the upper and the lower teeth could also cause a temporomandibular joint disorder. Another cause is stress that they face during work. Subconsciously or unconsciously, they develop habits like night grinding, or could also be due to the faulty dental treatments that have been done by some doctors, or in even some cases, eruption of third molars, which happens after the age of 18. And when there is not enough space for a third molar, it alters the articulation between the upper and the lower teeth. So this also, over a period of time, can go into a temporomandibular joint disorder.
Doctor, if there are people listening that are resonating with what you're saying and that they suffer from these headaches, the upper body aches, and even the night grinding of the teeth, which you were mentioning, can you go through some of the treatment modalities that are available?
First thing is that you take an opinion with a dentist, a dental specialist who specialized in or qualified in treating temporomandibular joint disorders. We do a proper diagnosis on what is the cause. Secondly is that these patients during their acute phase of the pain, they might have to be on some muscle relaxants along with medications and counseling. They need to be doing some physiotherapy, and they have to be on a soft diet for some time to reduce the pressure on the joint at that acute phase of the pain. Next is the patient will have, because of the spasm in the muscles, in the initial stage of the treatment, we give a therapy called as an oral therapy appliance called as a positioner. This is according to one concept that I'm dealing with that is called as a smilist therapy. What the positioner does is that it holds the teeth and the jaws in a particular position that causes the muscles and the ligaments of the joint to relax, and this is a recovery phase. So after this recovery phase, the proper dental treatment needs to be taken up, like if it is the cause has been replacement of the missing teeth, the orthodontic alignment of the teeth, or it need to be attended, or else the condition can again be reversed. The next phase is a surgical intervention. Suppose the cause could be due to an accident. Sometimes in arthritic patients also develop, just like any other joint, the temporomandibular joint also will start showing symptoms of arthritis, which will need intervention treatments like arthroscopy and arthrocentesis, where they do a flushing of the joint. These are all the surgical intervention treatments for temporomandibular joint disorders.
I think the most important thing is that people listening, if you are suffering from any of these symptoms, there are small little changes that can help you, and also there are a ton of professionals that can assist and can help fix these problems. Dr. Brigitte Kunjumon, thank you so much for the chat this afternoon. Very interesting stuff.
Thank you so much, Sean.